Hi, I'm Amina, a nurse practitioner at Rejuvn8 Aesthetics.
And I'm Steph, also a nurse practitioner at Rejuvn8 Aesthetics. So I asked you guys on my Instagram to do some Q&As for us. I did a question box and you guys flooded us with a ton of Q&As. So some of them were repeats. I combined a lot of them. We're going to go over those with you.
And I will be reading all your guys' questions. Question number 1. I've gotten Botox a bunch before, but want more lip than my eyelids. How to get this?
Ooh, this is a super common question. So the muscle around your eye pulls down and in. And some people are a little bit stronger with that, right? So when you smile, it can create wrinkles, which brings your eyebrow down. So when you Botox that muscle, which relaxes a muscle, you put it right under the arch of the brow or the tip of the brow, depending on what you want your lift to look like. And if you have a strong muscle that pulls down, it's going to relax that to give you a good lift. However, if you don't have a muscle that's super strong and that pulls down, you're really not going to get a brow lift with it. So being assessed and talking about that with your injector is a huge benefit to you and your outcome to make sure that you are going to get a realistic outcome with it. With that being said, the lift that you do get is only about a millimeter or two. It's not a surgery to your brow.
Question number 2. Someone told me Botox is poison. What do you think?
Oh, I love this because you know I'm crunchy. Okay, so Botox is a natural toxin. It's botulism toxin. So used in small controlled doses, which is how we use it in aesthetics, it is perfectly safe. However, if you do use large doses uncontrolled, then it can give you a toxic effect, which is actually a food poisoning. And that can paralyze your muscles and be life threatening if it is given in those doses. So, cosmetically, no, you should never have to worry about Botox being a toxin that is going to harm you.
Question number 3. Does Masseter Botox give you jowls?
Love this. This is a super common question. It kind of comes in waves for us. And I think it depends on social media trends and what is being talked about on TikTok and Instagram and things like that. So I do a really good assessment with all of my clients. So I feel your masseter muscles. Are they bulky? Are they large? Are we getting tension from food? This all comes down to assessment. So if you are younger and you don't have laxity in your skin and we treat your masseter muscle, you will not get jowls. Sorry. However, if you got to think that the masseter muscle is it's a muscle and you're getting it treated because it's bulky. So if we do the Botox, which stops that muscle from contracting, and we start to debulk that muscle over time, then the skin that's taking up that area will come down and forward. But if you have good skin quality and you're taking care of it with microneedle and keeping your collagen up, you will not get jowls. I always tell my clients, worst thing that happens is, God forbid, if you feel a little bit jowly, we stop getting the masseter Botox and your muscle will bulk back up and it refills that volume out again. With that being said, you also could get the masseter Botox, debulk the muscle for cosmetic and functional purposes. And if you're like, I'm getting a little bit jowly, then you can do jawline filler to kind of combat that as well. So I would say overall, as long as you're being assessed and you have that transparent conversation with your client in the beginning, then you shouldn't have to worry about it.
Question number 4, which is a very popular question. Can I get Botox if I'm breastfeeding?
Sad question. So, no. Because of safety and uncertainty, let's be so for real, nobody is testing and doing research on pregnant or breastfeeding women. You have a fetus and you have a little bit newborn infant, which is way more important than your Botox. So at Rejuvn8, we're not doing some Botox on breastfeeding or pregnant clients.
We will see you after, though.
Yeah.
Question number 5. Does Botox fill in your wrinkles?
Ooh. So what fills in your wrinkles is filler. Botox is a neuromodulator. It stops your muscles from contracting, which will soften your wrinkles over time if you stay consistent with it. However, filler, very different, is a hyaluronic acid, and that is injected to add volume to areas, which can help soften wrinkles over time. Think smile lines, marionette lines, lip lines. So Botox and filler have very different mechanisms, but Botox does not fill in wrinkles. It will stop them from getting worse, and it will soften the ones that are there at rest over the course of your duration of getting Botox.
Question number 6. How long does Botox last?
So Botox will last about 3 or 4 months, but it kicks in about 3 or 4 days. It peaks at 2 weeks, and then like a bell curve, it will slowly fade away over time. It's not something that you wake up one day and it's just gone. So the word last is used loosely because we set realistic expectations with our clients. So it's not, you're not frozen until the 3 to 4 month point. You should have about 60% of your movement back by that 3 to 4 month point.
Question number 7. Is there a way to have freeze so I can still show expressions like smile and raised brows?
Most common question we get.
I like this one.
So I'm gonna refer to this as baby Botox, which we don't do at Rejuvn8 because dose equals duration, and that is just hard cold fact. So the more you do, the longer it will last. The less you do, the faster it wears off. I always have this conversation in my consults and transparently with my clients. So this is the easiest, simplest, way to think about Botox. These are your muscles contracting. They all move. You do the Botox, it stops them from moving. It slowly starts to pop up and start moving again over the next 3 to 4 months, like that bell curve that we just talked about. If you only do a half a dose, you're only half freezing. So these continue to move, leaving you with that brow raise, little bit of movement, and these ones are going to pop up quicker. So I always, if you want a little bit of movement and you kind of like a more realistic, natural outcome, then that's fine. But I always just say it will wear off a little bit quicker, so you might have to get it a little bit more frequently, but not a bad thing. It all depends on your goals. If you like this, and if you have any more Botox questions, drop them in the comment box below. Hit like, subscribe, follow us, share with your friends, do all the things, and we will continue this in our next series. Bye!